Good evening. My name is Ajit Sachdeva, and I'm the Director of the Division of Education at the American College of Surgeons. I also have the distinct honor of co-chairing the steering committee of the ACS Academy of Master Surgeon Educators, along with Dr. L.D. Brett. We are delighted to welcome you to the second in the series of Fireside Chats of the Academy. And just to give you a history of this series, about 7 months ago, towards the beginning of the pandemic, we decided to appoint a special committee of the Academy to address the training needs of our residents during the COVID-19 pandemic and to pursue opportunities that would be innovative and that would lead to transformational change in the residency training paradigm and surgery. So with that in mind, the committee got going. We appointed 3 subcommittees. One of them is the subcommittee on novel teaching techniques and methods that is headed by Dr. Mohsen Shabahang, who is the director of the Geisinger Surgery Institute. And this fireside chat, along with the grand rounds, is sponsored by that subcommittee and through the efforts of the subcommittee under the aegis of the Academy. We are so delighted to have with us this evening as the speaker for the fireside chat, Dr. Carlos Pellegrini, who will be formally introduced by Dr. Shabahang. But I'll just mention 1 or 2 words about Dr. Pellegrini, myself, having known him for all these years. Dr. Pellegrini is an absolute legend in the field of academic surgery and surgical education. He has been integral to the Academy. He is a founding member of the Academy. He serves on the steering committee of the Academy. And also, for those of you who do not know, he was the chair of the ACS Accredited Education Institutes that we launched together several years ago. So with that, Dr. Shabahang, I'll turn the floor over to you to formally introduce Dr. Pellegrini. Thank you.
Thank you so much, Dr. Sachdeva, and thank you everyone for joining us tonight. I think I'm going to go to the next slide, and we're going to just talk about some of the housekeeping rules. Just for you to know, you are muted. If hopefully you're muting yourself, but we can also mute your the electronics. Please feel free. Some of you have submitted questions already, but please feel free to make comments and submit questions through the chat function of this Zoom platform. And at the end, we'll have a QR code for you to provide feedback. This will be recorded, so if any of your colleagues or students or learners want to listen to it, it will be at the address that's on the screen. So with that said, this is a distinct pleasure. I've been looking forward to this, to have a conversation with Dr. Carlos Pellegrini. I'm going to ask Dr. Pellegrini to say a few words about himself. Obviously, for most of the people who've been in the surgical world, we have heard Dr. Pellegrini at the Clinical Congress and other occasions, speaking about things that are not necessarily the clinical practice of surgery. He was the chair of surgery at the University of Washington and the chief medical officer there. I think without further ado, Carlos, welcome. Thank you so much for joining us tonight. And let me just say to everyone, obviously, if you feel comfortable, please turn on your camera so this can be more of a conversation. So Carlos, I'm going to start by asking you just to tell us a little bit about your career. I know, it spanned from 1970s to just recently 2 years ago, but I'm going to just let you tell us a little bit about your career and some of the highlights.
Okay, well, first of all, good evening to all of you who joined us today. I'm delighted to be here, and I think we're going to have fun. This is the main interest and attraction, and hopefully we'll learn something together. Secondly, I want to thank Mo for inviting me to do this fireside chat. and most certainly recognize that behind all of us in the American College of Surgeons stands Ajit Sachdeva, who is the director of the Division of Education and whose work has resulted in all the things that we all take credit for. So with that being said, you wanted me to tell you a little bit about my career. I was born in Argentina, and the colors of the scarf that I'm wearing reflect the Argentinian flag. For those who may not know, is blue, white, and blue. And I was educated in Argentina, and my intention was to remain in Argentina after medical school and residency. But when I finished my residency in the mid-70s, Argentina was facing a very significant problem from the standpoint of political environment, with a dictator in place and a fascist government at the time. And I didn't have a job. I was lucky to be offered a fellowship with Dr. Skinner at the University of Chicago. And so I took it. I came to the University of Chicago. I stayed there for a year in the fellowship. I loved every aspect of what I saw, and decided to retrain myself again in the American system. So I did a residency again at the University of Chicago, and then took a job at the University of California, San Francisco. I stayed in San Francisco for 14 years, and then the opportunity came to be chair at the University of Washington. And so I moved to Seattle, and I was lucky enough to be chair for over 20 years. And then at the end of my stage as chair, I was asked to be vice president for medical affairs and chief medical officer of the health system, something that I did for about 3 years. During those 3 years, though, I knew that I was going to retire. And perhaps this is my first tip for those who may be around that time and that age. And I started planning for that. So I went back to school, and I had an interest in human relationships, and I studied and eventually certified and became an executive coach. And now I do coaching of in healthcare, primarily of healthcare leaders on the leadership development aspects of their lives. So that's in a nutshell my life.
Excellent. Thank you. So I'm going to ask a first question, which is, in these transitions in your life, how do you know it's time to make a transition from one thing to another? What would your advice be to young people and people mid-career and later career? How do you know when it's time to move on from one thing to another?
Interesting question. I would say I never looked forward to moving from one place to another. So in the United States, I only moved from the University of Chicago to San Francisco, and then San Francisco to here. University of Chicago did not have a job for me when I finished my residency. So that's very simple. Otherwise, I would have stayed in Chicago. I love Chicago. I love the University of Chicago and the people that were there. I went to San Francisco, and I loved San Francisco and my job. But a series of things happened there. First of all, I was very interested in leadership, in the leadership aspects of the life of a surgeon. And I was not looking for a job, but I was open to the possibility of growing in my leadership, in my ability to exercise more leadership. And second, I had been in the reserves for many years by then, in the Army Reserves as a Army Medical Corps. And I was brought to active duty and spent the time of the 91 war on active duty. So when I returned to San Francisco, it so happened that the University of Washington was looking for a chair. And I loved the opportunity. I came to the place, I loved the place, and I stayed there forever. I would say my advice, if I had to give an advice, is not to be setting artificial times, not to be looking for a job unless you don't like the job that you have. If you don't like the job, you're changing. But if you like the job, as I did at UCSF, don't look for a job. The opportunities will come. And when it comes, you know, do a little bit of an intellectual challenge, put the pluses and the minus together. And then if things appear to be okay, sleep on that for a little while, and then let your gut make the decision the next day and decide what you want to do. So my default is staying on the same place. I know that some people would advise that you change every 5 years, 6 years, 7 years. I personally don't like that, particularly in a leadership position, because I like to see what's happening with what I managed to do. Is that fair?
Absolutely. And related to that, so you were at University of Washington for a good number of years. How did you bring about change and culture change? And when did you know that, you know, that the things you were doing was making impact? And how long does it take to make that impact?
How do you bring change? I would say one step at a time. I think that part of leadership, as I see it now, I don't know that that's necessarily how I saw it, you know, 25 years ago when I came to Washington, but as I see it now, part of it is having a vision. And I had a vision, and you know, my main interest in life had been education. And by that time, I think I was already involved in the ACGME and in the Residency Review Committee, and I had seen different types and philosophies of programs. And my vision had been, for some years, the changing on the paradigm of training of residents from a primary focus on technical aspects to a expanded, what I call the expanded focus in the development of the person, development of the total person, development of a physician first, and then a surgeon, development of somebody who could express compassion, express empathy, have good communication aspects, have respect for other people, et cetera, et cetera. So my emphasis there was, what kinds of modifications can we do progressively, okay, in a residency program to move the needle from being solely concentrating on the technical aspects of surgery or in the delivery of surgical care to a situation where we put emphasis on all these other things, having little chats. I started, for example, having a chat on Friday evenings with residents in surgery about life in surgery, but not about a clinical case, right? And then I have my conferences on clinical cases. My specialty was in the esophagus, and you know, I was lucky enough to have a busy practice, so we did all of that on the side as well. But I think I wanted to change that emphasis. I also wanted to change, remember this is the early 1990s, the emphasis from a residency characterized by people that all look alike and thought alike and came from same cultural background to one of diversity. And I think the combination of the two led to increased number of women initially, then increased number of people from other countries and opportunities of different kinds. And that then made me focus on slowly changing the environment in which we lived. An environment that I wanted it characterized by respect for everybody's values, by appreciation of everybody's ideas. And I think those things sort of, you know, developed over time. That's why I would have never considered leaving at 5 years or 10 years or, you know, until and unless I was fired, I wasn't going to leave my place.
Excellent. I once again, for all the participants, you know, I will keep going unless I see something in the chat box. So if you have any questions, please. And we had some questions sent before that we will get to as this goes on. Carlos, you were nice enough to send me a writing that you had done, and I want to make sure that we get to that because that was so important. And you talked about joy in a career in surgery, and talked about the aspects of gratitude and engagement and expectations. And I wanted to make sure our participants hear it from you and hear about that and how your journey took you to the thought processes about this concept of joy, which obviously is extremely important in today's, as we talk about trying to find joy and so on. I just wanted to hear from you and have our participants hear from you regarding kind of both your writing and also the evolution of the thinking.
Well, my writing originated from questions that a couple of people my age and myself were thinking about. If you had to define your feelings with regards to the life and surgery that you had. I had been in surgery 47 years by then. What would you say in one word it is? And to me, in one word, is joy. Now, joy, I think, in this, the scale of human emotions is probably at the very high level. And then, I did some analysis on my own to say, what are the elements that have brought me joy in my life? And I preface this by saying, first of all, I'm not giving anybody a recipe here. I think everybody has different ways of attaining, a feeling of joy. I think they're all legitimate. But there are some principles that I have found that have helped me during the course of my professional life, in particular, to be able to fend off, if you wish, the ordinary misery that life brings us every day, the EMR problems, or the delays in starting a case, or the bumping of a case, or more realistic, the death of somebody that we have operated on, or a serious complication. Those things are going to be there with you all the time. So how do you try to fence those feelings off and feel more comfortable? And I have found the three things that you mentioned, and I told you. The first one is gratitude, is taking the time every single day, and I do this every single day of my life, to find, even for 5 minutes or 3 minutes, what are the things that happened today that I'm grateful for? And you will always find something you're grateful for that day. I think if you start not finding anything in one day, you have to start questioning, where are you in your life? And if you want to, I refer you to a paper that I wrote a few years ago, which was Swimming Against the Current. But in general, I would say most people that are present here can find gratitude on something that happened that day. It could be as small as a meal that you had that you really enjoyed, or a smile that a friend gave you that you did not expect, or a hug that a patient gave you or a family member gave you to thank you for something that you had done. A good word from somebody else. I try to look every day into every cranny of my life for that day to say, what am I grateful for? That feeling of gratefulness, psychologists have shown, and I learned all of this in my coaching studies after I have finished my surgical career, but they have shown that elicits a number of changes in your brain and your chemistries and so forth that give you a sense of peace and a sense of contempt that you would otherwise not have. So gratitude and looking for gratitude. Some people talk about journaling it. Mm-hmm. And I have not been fond of journaling it, although I do confess that I got a little app that allows you to do that and reminds you at 6 p.m. to do that every day, and 2 little questions. And I do it now because I find that it's fun. The second one is is a little bit different, and we're talking about setting expectations and how do you how I believe that by setting expectations very low, I realized over the years, there's nothing that I will be doing in my professional life that is tied to a certain delivery to me, right? I'm doing things in my life. The more that I can do things in my life for the sake of saying, I do them because I want to do them. I do them because they bring happiness to me. I do them because it is right thing to do. That's the most important thing. I do them with full understanding that there is no compensation for that in the broadest sense that you can imagine. Then what happens is anything that I get in return, it's always a matter of joy because it's not expected, right? So if you were expecting somebody that you did an operation on to be very thankful for what you did, to, maybe somehow express that in one way or another, and then the person doesn't do it, you feel down. But if you, instead of that, say, I'm a surgeon, I do the best job that I can for this individual because that is my job and that is my joy doing it, and that is the right thing to do, and you do it, and then the person comes back and brings you a cake, it's a whole cake. But if instead of a cake you were expecting 3 cakes and you get only 1 cake, then you say, where are the other 2, right? As opposed to saying, I love the cake that I was being given here. So that the expectations, I think, have a lot to do with that. And the third one, to me, is engagement. And engagement has 2 aspects to it that I think are very important. By engagement, I mean getting involved on everything. Getting involved in my hospital, in the policies of my hospital, fighting administration when needed, supporting administration when I can, doing whatever I can, because that brings me a feeling of control on my life, a little bit more control. I'm not under the illusion that you're going to change the world, but you change one step at a time. So engaging in the hospital is important. Engaging in professional societies brings you the joy of networking with other human beings. I would not have met you, Mo, were it not because we're in the academy. Mm-hmm. And I would not have met Ajit Sachdeva, because if I was not enrolled in the college and in the education side, because we're in 2 different parts of the country. So those human connections bring a lot of joy to anybody's life. So those are 3 pillars that I consider important for the life of a surgeon. Of course, everything has to be anchored somewhere, and I think that there are some core elements of your life, like your life at home. If you don't have a partner or a child or somebody to love, you will have a friend to love, or you will have somebody. But that is also, I think, a core that you need to have other things make sense for you.
Carlos, I'm gonna, so it's interesting because obviously we're in a competitive field, and I'm just trying to channel questions that people may have and say, great, gratitude, engagement, expectations, but I'm a surgeon, I'm a highly competitive person, I can't have low expectations. In the concept that you had written about, which is this concept of say yes, be engaged and say yes. I can see someone saying, wait a minute, unless there's compensation of some sort, I'm not just going to go and say yes to everything I'm asked to do. How would you convince that younger surgeon who says that, and maybe I'm channeling some, but these are things that we hear through our career from people. What do you mean? Because I tell people to say yes to most things, and they say, what do you mean say yes to most things? I need to put boundaries around my life, otherwise it's out of control. What would you say to that?
Well, it is interesting because, first of all, I think that I am not saying you should surrender and people ask you to do something and you say, yes, I will do it. Yes, I will do it. I'm not trying to say that people should be slaves of anybody or even do things that are not morally right and say yes for the sake of saying yes. But I do think that as a modus operandus, if your default is to engage, I talk about engagement. I don't talk about just simply saying yes, right? I engage for a reason. I engage for a purpose. Sometimes it's something that will have a direct impact on my life. If you engage in the operating room, work and policies and administration, you engage in in who gets what resources, you engage in expanding or shrinking the amount of time available for surgeons to operate, you engage in capital acquisition, and all those things, to me, bring control to my life, not lack of control, bring control to my life because they allow me to be a participant in the decision making. Sometimes I will get my wish, and sometimes I may not get my wish. But I think at least they provide me with the sentiment and the feeling that I am doing something that A, I believe is right, and B, may have a benefit to me, but may benefit the system. I am not sure why would you volunteer for the American College of Surgeons? But I could ask you the same question. Why do you volunteer for the American College of Surgeons? And are you doing it for compensation? Is not just money. Is compensation may be for you the fact that you are chair of this large engagement in which you provide for a novel type of human interactions among surgeons in this country. And it's you who decides who's going to be the fireside speaker or who is going to be doing ground rounds next time or who is. So that to me is part of the compensation package. And I think that one has to be careful in the way one looks at things. But I sort of feel that going the other extreme and saying, unless I'm getting paid, I don't do it. It's not conducive, because then you start thinking, paid like what? Paid like a surgeon, paid like an administrator, paid in what manner? Sometimes the compensation is a recognition that people have for you. And I think that as you develop that, you become somebody trusted in the institution. I tell you, after being more than a decade at the University of Washington, I can more or less proudly say that there was no big decision in the institution that I was not asked for my thoughts. I didn't get away with everything I wanted, but I was asked for my thoughts. I was asked for my advice. I participated on that, and that brought me joy. Now, it doesn't have to bring it to everybody, but I submit to you that having surgeons always say, no, I cannot because I'm in the operating room, or I'm just busy with patients and I'm not going to do it, deprives the institution and the surgical colleagues in the institution of the wisdom and the proclivity to action that surgeons naturally have, right? So that's why I say yes.
Excellent. And I see some comments in the chat box. I see a comment that I do volunteer work in Cambodia for free, some of the most rewarding work I've ever done. And philosophically, it's very good for people to aim and shoot high and succeed. However, isn't it better to underpromise and over-deliver than the opposite?
And those are two great comments. To the first one, I would say, wonderful. I bet you didn't get paid to do that. Or at least you didn't get paid the same amount that you would have had if you were here. Why did you go to Cambodia? I bet you didn't do it because you were in a five-star hotel or that you were eating the best food in the world. But you did it, and it compensated you because you feel after you return that you felt great. As for the second one, I think you aim to the sky, you aim for the stars. And I think that that is a very laudable thing. And then you accept that the important part of life is not getting to the star, but is experiencing the journey as far as you can do it. Now, that is why I also think that that the second part of what I think I heard you say is better to under promise and over deliver than the reverse. Is I don't promise anybody that I will get to the star, but if the star is my aim, the trajectory is what I would consider the success of the journey.
Excellent. I want to maybe ask Dr. Joshi, if you're on, if I could ask you to ask the question that you put in the chat box, and if not, I'm happy to ask it. Just gonna give.
I am on. Can I
Please,
ask?
please do. Please do.
Yeah. So I am in my early to mid career of my surgical profession. So my question is it because I'm highly interested in engaging surgical education, and looking at your biography, I found that is it possible to have a good be a very successful surgical educator and at the same time have a very busy sort of clinical practice? Because as you said during the start of your interview that you also had a very busy surgical practice. Is it possible to juggle between these two?
And I want to say, Carlos, that Dr. Joshi's question, there were a couple of other questions that were submitted that were on the same theme of juggling being the clinical practice and obviously administrative responsibilities that you had and being an educator, and how did you do that?
So first of all, I want to thank Anip for having the courage to stand up and say what he said. But I don't know if it was my connection. I got cut off on the last part of his sentence. So I understood that there was can you be a surgeon and an educator? That was the first question.
Exactly. And the question was, is it possible to juggle between a successful academic surgical career and a busy clinical practice simultaneously?
I personally think it is. I think it is demanding. But if you sort of morph the way you do everything to make almost everything that you're doing a teachable moment, that I am a believer that people learn a lot more from the hidden curriculum than from the stated one. And so what I think is very important, and what I would say to Anip is, do what you think is right as part of your work, as part of your career, as part of your busy clinical practice, and share that with the persons that you're training, and allow them unimpeded access to what you do. If you do what is right, you're teaching people a lot more than if you give a lecture on what is right, because they will not listen as much to what you say as they will see what you do. So to the extent that you practice every day, and if you think of the development of the full person, to the extent that you practice every day, respect for everybody. The residents are seeing how do you treat the scrub technician? How do you treat the nurse that is with you? How do you relate to the anesthesiologist? How many times do you see people doing rounds and a surgeon, I am mostly around surgeons, commenting, oh, the cardiologist didn't see the patient yet. Oh yeah, no, they come to work at 9 a.m. and they leave at 4 p.m. They didn't have time to see my patient. We're surgeons. Those comments undermine the faith of the people that are listening to you in the whole medicine. So, I think we have an opportunity, and just that comment, right? It teaches, it's a negative teaching moment, but if somebody makes it, if a resident makes it, that they couldn't get a hold of somebody because they are lazy or they don't work as much as I do or whatever, I take the opportunity to correct them right there. And I expect respect for every person. Many times I would see a patient and there was an internist or an ID or a nephrologist leaving a recommendation with which I didn't agree. But that doesn't mean that I have to demean the person in front of my residents. I would say, I am sure, I take the opposite approach. I would say, I am sure he had a good reason to say what he said. So let me call him up, or let me call her up, and find out why did he leave this recommendation. And then I'll tell you what we do, because I am the captain of the ship. I'm responsible for the care of this patient ultimately. This is a recommendation. Let's see what, and many times you find out that either there was a misunderstanding or there was, I did a lot of esophageal surgery in the mediastinum. I had a lot of patients with atrial fibrillation post-op. Is most of the time is something that is, recovers pretty soon. Nothing happens. You don't need to do any therapy. Well, maybe somebody got called and somebody proposed a lot of things to do. And you say, no, I don't want to, amiodarone, I don't want this, I don't want that, I don't want shock, let's just wait it out. But you can say it in a way that imparts respect on others. And I'm saying all of this to Anip because I think that that's the way a busy clinician teaches. Is teaching with his life and his work. It's not.
I wanted to ask you to react to a statement. And Megan Miller, I'm going to call on you next because you have a question in the chat box. But do you see sometimes I look at leadership as what attracts many to leadership is the educational aspect and the mentorship. Obviously, you've gone from leadership to coaching. Your reaction to that thought process?
I'm sorry, the reaction to the process of?
To the thought process that leadership is,
yes.
Many of us are attracted to leadership because of
yes.
the educational value and the mentorship. Do you agree with that kind of concept?
Leadership and mentorship.
And that leadership is a form of education, that we go into leadership to be
absolutely. Leadership is a form of education. Yes, I don't have any question about that. I have a slide that I use, like a last slide when I'm talking about any little talks on leadership, that essentially says the most important thing for you to remember as a leader is that every single thing you do will be seen by others and will be imitated by others. Because if you're a leader, you have followers, and followers, imagine a flock of birds flowing. If the first bird crashes, everybody else crashes, because that's what they are following. So if you do something as a leader, people are watching you, and part of the mentorship that you will be successfully imparting is with your example.
Dr. Miller, sorry to put you guys on the spot, but I think your question coming from you most probably means more than coming from me.
Thanks so much, Dr. Shabahang. It's really a pleasure to be here tonight. It's great to see so many familiar names and faces. Dr. Sachdeva, it's great to see you as well. And Dr. Pellegrini, we haven't had the chance to meet in person yet, but I am also an alumnus of the University of Chicago. I did my surgical residency there, completed in 2016. So we have that in common, as well as our interest in education and excellence in our surgical specialties. So my question is that I've actually been advised to choose between pursuing research in my subspecialty versus pursuing a track in leadership and scholarship in education, with sort of two reasons behind it. One being that there's not enough time and energy to be great at both, and that career advancement really depends on selecting one of those paths and forging full force ahead with one and not, quote unquote, wasting time with the other. So I was just interested to hear if you had any feedback or thoughts on that.
Wow, Dr. Miller, that's a difficult one. But let me try to see if I can answer your questions at least a little bit, because I think that there's truth in saying you have to limit what you're doing, because you're not going to be able to be good at everything, and you want to be good at certain things. But when it comes to separating leadership from almost any other aspect of our life, be it research or education or clinical practice or administration. I don't think there's a separation. I think you can exercise leadership in research. You can exercise leadership in education. Leadership is in essence is the ability of a human being to influence others to take a certain path because they trust you. That's it. Okay, they do it voluntarily because they trust you. They think you know where you're going, and they want to, and they think that you chose the right destination, so they want to get there with you. So you can do that. That I don't think has a lot of incompatibility. Now, pursuing a career in education versus research, I think we have to start considering the practical aspects of it. I think you can always train and educate surgeons in general with your clinical practice, with your research, with your humanity, with all the beautiful things that I'm sure you have as a graduate of the University of Chicago. But education, to become an educator, you become a master in education, to take courses, to go deeper into the educational side, to perhaps take a program directorship, to do a lot more things on the educational field will take a significant amount of your time, as will doing a career in research, right? So I think that there is a distinction there where you may have to say, how much education and training do I want to do, and how much research I have to do? And then when you talk about research, you have to say, what type of research do you want to do? If you're going to be doing some more superficial research in your subspecialty, more clinically oriented research, that's one thing. If you're going to be pursuing federal funding for your research and grants and doing deep science and bench and laboratory research, that's going to have, a 30-40% of your total time and dedicated to that. And so I don't see that as compatible with then having another major activity in the educational area. Does that give you a little response to what your question is?
Yes, absolutely. That's very helpful. I think you kind of hit the nail on the head that we can always be leaders and educators, but when we really delve into the deep part of it, and where, like you said, 30 to 40% of your time might be spent, it's just unrealistic to pursue both simultaneously and with, success. So thank you.
Excellent. Carlos, another question. I think Dr. Ball's, his microphone is not working, but the question is the following. I appreciate that you mentioned the additional members of the surgical team, the techs, the nurses, etc. Were there any programs you put into place to help everyone in the OR work together more effectively, perhaps training together as a multidisciplinary team, or something similar to the weekly non-clinical meetings with your residents?
We didn't pursue it specifically with the team in the OR any different than other teams at UW Medicine, but we did have, through our simulation work, we did have a very large experience with team steps, and then we converted in-house team steps into something we call team course, and it's essentially a way to train, eventually to train trainers, to train then people within their teams in the basic aspects of communication, mutual support, shared mental model, situational awareness, etc. Right? So that people could work together in a seamless environment. For some reason, even though that was beautifully done in perinatal, in ICU, and a number of other areas, in our operating room, we were never, at least I was never happy with the results of the implementation of this type of program, because it seemed to me that we were always operating in three different silos. The anesthesiologists are on one side, the nurses, technicians, and support personnel in another side, and the surgeons in another side. So I cannot claim that I felt happy with what we were able to achieve in the operating room. But I can tell you that team steps and subsequent our own team course was an extraordinarily successful team training, I think, for other areas. We did also a lot of using that team steps philosophy. We did a lot of training in interprofessional training, where we brought into the team at the level of medical students primarily and earlier residency training, we brought pharmacists and social workers and nutritionists and a number of other people that could work together as a team.
Excellent. Carlos, I want to ask a question that we discussed a little bit prior to this in our conversation, that what are the things you have learned through your distinguished career that you wish you knew 30 years ago or 40 years ago?
Well, you know, I would say I love learning and the idea of continuous learning in your life. At my age, I am currently enrolled in a course at Stanford, and I have been enrolled in courses in Yale and other places. I have finished courses, certified. My wife asks me all the time, "You're taking another exam. What do you want to get?" I said, I don't want to get anything. I just want to prove to myself that I learned something else, and I know. So, is there something that I wish I would have known before? I enjoy the process of learning every single day of my life. I don't think that there is a life for me unless it's challenged by learning something new. I would have loved when I was a chair and I had the opportunity to exercise leadership to have known all the techniques of coaching that I learned later, because mentorship and teaching are quite different aspects among themselves, I think, but they are also very different than coaching. And coaching is a beautiful way to influence the behavior of a human being, which is essentially education. So I wish I would have known all those techniques, which now they appear to me to be, God, some of these things I kind of did, but I had no idea that I was doing them. And I could have gone the extra step to do it. That would have been great for me.
Can I ask you in a very kind of, and I know it's a much more complicated conversation than this, what is the fundamental difference between mentorship and coaching?
I would say there are many, but I would say, you know, a mentor is a friend, a committed person to the mentee, somebody that is going to promote the mentee among other people, somebody that is proud of that relationship, that wants to influence the mentee, that can tell the mentee, this is what you should do. In my opinion, this is what you should not do, etc., etc. A coach is a little bit of a different category. A coach is not going to tell you what you should do. That's not a coach, that's a consultant. A coach is going to simply dig into your mind, knowing you every bit more as time goes by, to make you think and to make you realize what is it that you want to do, what are the pros and the cons in that type of decision. But it leaves it up to you entirely to do what you have to do. A coach by nature is a very curious person that doesn't make any judgment on what you say, as opposed to a mentor that may say that may be a mistake. A coach won't tell you that that's a mistake. A coach is, why do you want to do that? And explain to me, give me more, tell me more about this, that, etc., etc. A coach attaches virtue to every sentence that is being said. And I've learned in my life that if you look at any idea that has been given to you, every single idea has at least a 10% of it that is right. So I'm looking for the right part of the idea to see, is there something behind that to support that? Is there something that can be pursued on that? Or is the 90% that is wrong going to prevail here, and we just have to bring it to light and make this person understand. A coach is not there to make you happy or to make you pleased, but a coach is there to give you a safe space where you can discuss issues that you're dealing with, programs that you're thinking about, sometimes out of the box, big things that you wouldn't dare say to your own boss in the institution, but you can run it with a coach, and the coach may then start working out with you and dissecting that thing with you, and then you will figure out whether it's the right thing or the wrong thing to do.
So
Is that
can we as leaders use the coaching skills to help those that we lead?
Oh, I think we could. I think we could. You just have to sort of change your mentality, because I have a few years in the academic world and a surgeon and experience in administration. The most frequent question that most of my coaches at the beginning of our relationship ask me is, what would you do given that? I just had this idea, this thought. What would you do doing that? And I can't tell. I just simply say, it doesn't matter what I would do. You bring it up. What is it that you want to do and why? And let's work on that, right? A mentor or a teacher would say, this is what I would do. It's perfectly legitimate. This is the right way to do it, right? For me, there's no right or wrong way. For me, it's what is probably best for you as my coachee, and what taps on your strength best. We do a lot of diagnostic tests about what are your strengths, what are your weaknesses, etc. What can I do with you? If you are going to be playing, best as a forward person, I'm going to teach you how to get the goal, the ball into the goal line. If you're going to be defense because you have the strength or the muscle or the that you wish, then we prepare you in a different way.
Excellent. It's 7:53 Central Time, and I see two questions, and I wanted Dr. Pellegrini, are you on? Would you like to ask your question?
Yeah, can you hear me?
Yes, we
Oh,
can.
yes.
Oh, thank you, Dr. Pellegrini, for your great presentation, as usual. I would like to ask you, how do you deal all the clinical duties, your academic life, your society duties with, how do you mix that part of your life with your personal life, and how do you avoid burning out?
Well, there are at least two different parts of the question. How do you avoid burnout is one that is a little bit more difficult to tackle, but is related to developing resilience, and the things that we talked about earlier play a role on that. How do you mingle things? I think that I just have one life, and my life has different portions. We all have 24 hours a day. So how we distribute those hours and what do we do with those hours is pretty much up to you. So I devoted initially and during my middle career a lot of time to the operating room and a lot of time to my institution and my education and so forth. As I grew older on that, some of my activities were then part of a center where there were other surgeons that could do what I was doing, that I had trained. And I started having a little bit more extra time that I could then dedicate to my professional society's activities, which were relatively heavy towards the end of my career. So it's a matter of where you are in your career. You can't do everything at the same time. And if I'm early in my career, I would say concentrate on doing something right and becoming known for always, doing the absolute best for the patients, the absolute best for the institution, the absolute best for your students. And as you move forward in your life, you get a little bit more extra time if you're in academic medicine to do the other things.
I wanted, with the little time we have, I wanted to make sure one of the questions that was posted, ask you, it's a big question for a few minutes, and then maybe finish with your final thoughts and lasting thoughts that you want to leave with all the participants tonight. The question was about how, through your leadership career, did you deal with conflict?
Excuse me, how did I deal with what?
How did you deal with conflict? How did you manage conflict? As I said, it's kind of a big question to leave at the end, but I just wanted to make sure, as the question was asked, to put it out there.
You know, I would say that dealing with conflict for me as a principle, okay, if I have to leave you with one thought, is to come into that conversation or that situation where there's conflict with the understanding that A, I do not own the truth, the whole truth, and B, there's always something right about what my opponent thinks, if I'm assuming that a conflict is between two people. So I try, and I think this is a recipe for success in the resolution of conflict, I try to figure out what is it that you're saying that is right. And I think that my way of opening the door in a conflict, and I'm talking at a very high level, so I won't go into the details, but my way of opening the door in a conflict when there's a difficult situation is first, listen to what the other person is saying. Assume that you don't have all the truth with yourself, with myself. Give credit to something that the person is saying and try during my listening, using my curiosity to figure out what is the part that is right. Because if I start my talking after I heard all of that with the idea of saying, you know, what I like of what you said is blank, I open the door in the mind of my opponent, if you wish, or my person with whom I have the conflict. I open the door. And I may say, what I like of what you said is blank, something or other, right? And I don't say but, and then I give my idea and my thoughts. And I have opened your mind enough that hopefully you're listening to mine. And then if you're reacting the same way I'm reacting, in a few minutes, we're talking. I mean, really talking, not just saying something, somebody else is saying something back, but really conversing and engaged in that type of conversation.
Excellent. Carlos, I want to just leave the last minute. What are your, what thoughts would you like to leave this this great group and people who are going to listen to this in the future? What thoughts and concepts would you like to leave people with?
Well, I would say from my perspective, I think that if you all would take the attitude of saying, I am responsible for what happens to me. Okay, I know that many things you don't control. But if you say, I am responsible for what happens to me, and you start from that point of view, you would make a lot of headway. You're not responsible for the pandemic, but you know what? You are responsible for what you're doing with it. You're responsible for whether you decide to wear a mask or not. You're responsible for the way you spend your time during it. You're responsible for a number of other things. And that way, I think you gain a sense of control in your life. And if you then use your moral compass and just allow your moral compass to point you the way, however aspirational it is, as we were saying earlier, it is the journey that matters.
Carlos, just looking at some of the comments in the chat box, it's clear that this has been very impactful. And thank you so much for sharing your wisdom. I would like to ask all the participants to wait for the QR code to go on so you can evaluate. And please get the word out about this. Our next one is going to be in February. Thank you so much, Carlos. This has been amazing. And Sach, I just want to leave the final word for you. I'm sure this has been so inspirational. Any final thoughts?
Thank you very much, Dr. Shabahang, Dr. Pellegrini. This has been inspirational as usual. You've shared immense wisdom with all of us, and we really appreciate your taking the time to be with us and to really guide us as we try and achieve the highest levels in our careers and try and emulate a lot of the great things that you have done. So thank you so much.
Thank you all for
Thank you.
attending. Thank you very much. Carlos, thank you again. I really appreciate
Thank you,
it.
Mo. Thank you, Mo. Thank you,
very
Sach.
much.